Welcome to Castell Insurance. I'm Phil Castell, and today we're going to be going over how to do a review of your Medicare Part D prescription drug plans for the year 2021. We have a dedicated site called ClallamPartD.com. So just enter this into your browser and away we go. This is a new site for 2021 and it's got all the programs that we are authorized to offer. And before I go into the program, let me share a couple of details with you. This is our website, so if you ever have any questions or issues as you're progressing, there's our contact information. Emails work great. If you want to create a login so that you have your information saved as far as medications and preferred pharmacy and stuff like that, that is wonderful. I'm just going to point out one thing in the fine print at the bottom of the page. It says licensed insurance agents may receive compensation based on your enrollment in a health plan. We do. We get paid a small finder's fee by whichever program we're working with, and that is how, as your agent, we're able to provide a service to you throughout the year if you have questions or need any assistance. Starting here, we could just enter the zip code and put in what programs are available, but I prefer to start from the beginning, so enter your preferences. I'm going to enter 98382 for SQUIM, and then it'll come up and say what county is that in. Obviously, we're in Clallam County. Now, even though I call this program Clallam Part D, this program is good anywhere in the state of Washington because the programs for Medicare Part D are the same throughout the county. This says we can enter any health information if we needed to, but because we're just looking at the prescription program, we'll just go straight into prescriptions. I'm going to show you a couple of interesting things. First, let's start with a very common generic for simvastatin. So I'm putting in simvastatin and it'll come up with what most people take, 20 milligrams once a day. If you want to get 90 days, you can enter 90 for 3 months. The pull down is right there. So I'm going to hit add here. Then I'm going to enter in a couple of different medications. The first one is one called Tresiba, and this is for diabetes, it's an insulin, and I'm going to enter the Flex Touch, which are the pens, and here 200 units, 3 pens for a month. I'm going to hit add. There's lots of changes going on with insulin for 2021, both under 65 as well as over age 65 on the Medicare Part D. So it's a good time to check and make sure you're going to be in a good program. I'm also going to enter Advair. This is for people with difficulty breathing. I'm entering the Advair Discus, and there's different strengths. We'll just leave this at this. It gives you the choice. There is a generic for this. So I'm going to say, no, let's just take a look at the brand name Advair, and we will take it from there. So I've added that. I've got 3 medications added. We now click continue. This is where you can enter your preferred pharmacy. And so it lists them all in SQUIM. If you wanted to enter a different zip code, for example, if you wanted to go to a pharmacy in Port Angeles, you could enter that, and it then shows you the pharmacies that are available in that zip code. So the program is very intuitive and will show you accordingly. And so I'm just going to pick Walgreens just for fun and click continue. Now the program it shows 24 plans available in 98382. It shows no Medicare Advantage because Regis Blue Shield is not on this site. If you are interested in Medicare Advantage, please call John or I at our office and we'll gladly explain it to you. It shows that there's 16 different drug programs and 8 Medicare supplements. We're only using this program for prescription drug. If you want to talk about Medicare, once again, give John or I a call. This is now listing all 16 programs based in the lowest price order. So here where it talks about the estimated annual cost, this includes the premium, any deductible, co-pays, includes a coverage gap or the donut hole, and so it shows everything. This shows that based on those medications, your total cost for the year would be just under $1,900. If we look further down the list, you can see the total cost is increasing as we go down. So we always recommend take a look at the first program and see how it looks. So we click on plan details. It shows here plan details. It'll show the co-pays based on different items, but that's just generic. We want to take a look at your actual prescriptions. It shows that the simvastatin is a preferred generic, and then it'll show that the Advair and the Tresiba are preferred brand name drugs. So we know what we're looking at here. But then the most important thing is, yeah, Phil, tell me how much is it going to cost? So we click here where it says total estimated costs, and it'll show 1,890. It'll then show on a month by month basis how much you would pay for the medication. So in the month of January, the simvastatin is $0, the Tresiba is $28, and the Advair is $416. This is because of the deductible that most programs have. If we jump down to look at April, in April, simvastatin is still $0, Tresiba is $35, and the Advair is $43. Then as we go further into the year and you reach the coverage gap, simvastatin is now $1.26. The Tresiba is still $35, and when you're in the coverage gap, the Advair Discus costs 25% of the retail cost. So if I go back up here, and it shows the retail cost for the Advair is $416. So when you're in the coverage gap, you pay 25% of that, or $104. But isn't this amazing? The Tresiba, the insulin, costs $644 a month, but you would pay $35 a month every month all year. So this truly is one of the benefits of these programs where things have really changed for the better. If you like the look of this program, we can click add to your shopping cart. Now this is going to come up with a warning, or it should come up with a warning, because we cannot apply for this program yet until October the 15th. So when we click continue to apply, its enrollment is not currently available. So that's, if it was available, you would just follow the instructions. That would take you to the enrollment application for that specific program. You just go through and complete everything, and Bob's your uncle, you got a new program for 2021. Thank you very much, and if you have questions, please feel free to reach out to my office. We would be happy to help you. Bye now.